my name. What's going on, Karen?
I did.
Right. Angelique usually sits here. So. Oh, thank you. I'm gonna let Angelique have her seat. And she usually sits in the corner there. So you do. So I'm like, she's here now. If you weren't here, if you didn't walk in with me, I might say no. I might be like, I'm gonna sit in your seat. Good, not good. Oh, I thought we were.
I enjoy.
Hello, Donna.
Oh, no,
How
you
are
want
you?
to.
Good. How about yourself? Good.
Good.
Um,
Sunshine?
Sunshines and rainbows as always.
Yeah.
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 Yeah. We're adult today.
Yeah.
So we transported a lot of them.
I was gonna ask you how that's going to.
Transported them to your program.
Yeah.
So you might pick them up. Yeah, and that makes sense.
Yeah, so we're trying to figure out, like, well, first get them placed in programs, but I guess
There's not a lot.
Rochester.
That's the.
How many people?
Well, Rochester, our place is shutting down, so there is no.
Oh, okay, I got you.
How many people in the Rochester area?
Who's in that program? I want to say it was like 85. And maybe around like 60 or something, 60 or 70
In the
in
Manch?
Manchester. So we're looking at, like, I know somebody reached out today saying that they're gonna be transferring their husband to the one in Maryland. I think it might be right on the Nashua.
Oh,
They were
that-
asking
I
for-
think that's the one run by,
So.
he used to be at Delta Health. Now he's into a lot of real estate. He's actually building, he ended up,
Oh, really?
yeah, he was in a Delta Health and then he ended up getting into real estate and buying real estate to make accessible, affordable housing for seniors.
Oh,
Wow.
And potentially put like adult day in the building that they're renovating and redoing.
Oh, here's a thought.
Yeah.
Put the resources where they live. Oh,
Right, no transportation
Yeah.
issues, no, like all those things.
Yeah.
Yeah.
You have a doctor in the program, because Delta Health generally have a physician, all of those things right there.
Yeah.
Yeah,
I think he was trying to start up a kind of like a PACE program.
Mhm.
Do you know PACE from Mass?
yeah,
So PACE is another federal type program. And the PACE has all the doctors, a pharmacy, like everything right there. You see everything right
stop.
there. Yeah,
Yeah.
including your Delta Health. So when you go there, it's filled with doctors, everybody you need to see.
So it's almost like assisted living, but you're living on your own.
Correct. Yeah.
When I started.
it's really sweet.
Yeah, PACE has never took off in New Hampshire, which is unfortunate, but I don't think the funding structure could support it.
It's all good.
Just trying to
Nothing,
figure out-
she's bored at her job, she was just telling me, Janet. Nothing to do, no worries.
Our adult day and just the program.
We've been seeing that, we're so sad.
Yeah, it is,
I mean. Staffing,
It-
both.
well, I think it's really been a combination of a year since COVID. It was like, we used to have like 7 full buses of people going there every day. And then COVID happened and it just never.
I'm wondering about the one in Alburn here and then St. John Newman's drop-in program, if their numbers have dropped too, or not come back.
Right, yeah,
I know
I'm
that-
not sure.
One of the daycares here in two.
Good morning.
One of them
Yes,
is a
but
lot
really-
down on 111A.
In 2023, DHHS did raise the
Perfect.
rate
I just made
for
myself a
Delta
note
Health,
to ask
knowing
you.
that they couldn't be supported anymore with the rate. I think they get like
that the
$50,
inbox
less than
is full,
$50
yeah.
a day each person.
Yeah,
And I think the daily running of that is close to like $85 to $89 a day to run it, for expenses just to break even. And they were getting, I think, like 40 something from DHHS. I don't think DHHS brought it up to the actual cost of the program. But they did try in 2023, they brought it up similarly to how they did the home care. But again, if your fixed costs remain the same and your enrollment is down, your fixed costs don't change. You still have to have a position, you still have to have all these things.
Trying to see if we can at least, transport people to other programs, other places, whatever. I know
Yeah,
some of them
you can.
we would, take shopping or do whatever. if you have
Is the
doctors.
transportation billable to DHHS outside the adult day health program? Or is it inclusive of the program?
In the past, it's been inclusive,
Well,
Yeah.
so it's-
my understanding.
So it'll be a lot harder for another agency to say, yeah, we'll take your patient, oh, and by the way, we'll still absorb the cost of the transportation they need because it's included in the daily rate. Like for you, it's more like interdepartmental, intercompany
Right,
funds
yeah, yeah, yeah.
moving.
Well, we do have, so like some people were like,
So
you
you
would bill,
Medicaid for the transportation, so you bill like a non-medical transport.
correct.
Yeah.
Yeah, or, you do have, like, a fatal free.
Yeah.
Yeah. Never know when the trickle down effect is going to be isolation, failure to thrive, medical nursing homes. Like,
Right,
that's gonna happen. Because right now they're seeing a nurse every day. Keeping up.
Have you looked
But
at your
it's a
email
decision
lately?
that has to be made, when Maureen and Sue called me in, I don't know, maybe it was May, when they first started talking about this. And like, hey, I'm sorry, I've had to make those same decisions, it's a decision that just has to be made. Will drain their organization otherwise. We close transportation. We just have to.
Morning. I'm good. How are you, Marina? Good to see you.
Sure. What do you want? Yeah, absolutely. Just Nashua, right?
Just Nashua area.
Yeah.
I'll give you the chance.
Hi. Hi, guys.
Good morning.
How are you?
I got a girl right now.
I know, I mean, it's kind of.
Right now, we're going,
Yeah, not
Perfect. Have you landed somewhere? Have you figured out your thing yet?
I can't tell you that I've figured it out.
Thanks.
Well, I know the last time we talked, you like, do I go back here? Do I stay here?
Yeah,
I'm gonna do.
Kind of feeling, I'm working with Manchester.
You were thinking about buying a bus or
Don't think of
vehicle,
buying
and accessible, yeah?
I've got money sitting there and I'm just,
Do I or don't I?
yes, the insurance scares me.
Yeah.
And but yeah, so I'm a compliance coordinator for Manchester Transit and that kind of, I just do whatever Ryan, Tracy might need.
No, because you
So
supplement,
as their new
you,
project gets off the ground, I'll.
Manchester Transit, all right, so that's not Southern Planning Commission, it's Manchester Transit, like Nashua, right? Okay.
Yeah, so I'm doing that, and we'll see what happens.
Can you do that remotely or do you? have to
Yep, I
travel?
do it remotely.
You live.
I live in Akron.
Yeah.
So I do it remotely. I go to Manchester a couple times a week.
Yeah.
So, but yeah, I still have a couple other irons in the fire.
Yeah.
that I can run.
Good, and you?
Oh, good.
See what happens.
secret to old age.
don't feel. Jesus, but you don't know. I'm telling you.
Starting,
Somebody just miraculous found the money, isn't it? Funny how.
The DHHS will do that, usually, talking to DHHS. And then submit it before the newsletter goes out, when the news story goes out.
The news story's already out there.
No, but normally, like when I was closing transportation, we'd have the DOT long before it happened to let them know. And then DOT would have had the opportunity to step up, so they should have been talking to DHHS probably at least a month ago. DHHS to say, slow down, let us see what we can do. Like, that would be the right thing to do, because now what happens is,
No, 68.
Really? Wonderful.
Thank you. Thank you. Thank you very much.
Anytime.
maybe
I
there's
got
a
brownie-
strategy
I got
behind.
brownie points.
Maybe the state is sitting around. It's like, you know what, we're done. If you can't make a decision to help the
Okay.
program, just say putting it in the paper.
So this is
maybe-
what's gonna happen.
Yeah.
I
So
did
now
log
that
to
could
call
be
you back when I got
It's
home.
fine, you didn't have to.
Thank you very
You're
much.
welcome.
I do
guess
have a
we'll just
question for
wait and
you
see.
at some
When was
point.
it? When was it? October 1st? 17. So we'll.
Oh, you got plenty of time.
Start of a whole new program by then.
Yeah.
No?
Okay.
Yeah. Options are endless.
Thank you, yeah.
Oh,
yeah.
For
conference. We didn't have it for a month, so then. Morning, do you want? I was gonna do. I know. I forgot to print it out until I was like, oh, wait, I can't check anyone off. I don't.
Thank you.
No, it's fine. Seriously, like no obligation, but.
Yeah. What you got? What you got going on?
Got it. Yeah. And then a digital empowerment breakfast for like social workers and people that work.
So I know you guys have an extensive mailing list.
You do, yeah.
Do you want us to forward that?
That would be really great, yeah. Yeah.
If you can shoot me the PDFs, I mean, we can get it in the follow-up email to this meeting.
Yeah.
We don't have to do it now.
Not now, okay, I didn't know. what you-
No, we don't have to do it now. No. No, it's one of those byproduct. I'm just sidebar things. Yeah.
How are you feeling, Mr. Bookie? There is a secret? What is it? Don't fall, okay,
Yeah.
I'll try my heck.
I'm
Oh my gosh.
You're on the way again, so I had to. I hadn't put it back in.
Okay.
Well, but don't twist in the middle of the night and then wake up with a bad knee, okay?
So.
I don't know. Maybe in my dreams I was running around Milford Oval. I don't know. Yeah.
What'd you hurt? Yep.
No, I came down.
One of the note takers wants to record.
First November.
See, I'm running out of shoes.
Is she having an posterior?
You
Never know, and.
They
don't. I had my knee done.
Yes.
Sending out the work.
Yeah, yeah, exactly.
Yeah, we've had over 5,000 pairs now. Yeah.
Yeah, because the hip could realign her.
Well,
Doctor just had hip
yes,
replacement.
first this-
Okay.
extra
Yeah.
right.
Been overwhelming.
Ooh, lucky her.
Yes.
It's hard to tell how much to get.
You get to be anybody you want to be today.
Oh, jeez.
All the votes you get.
Don't be me again.
Good, okay, good.
We can get one?
All right.
Oh, good.
Yeah, thank you.
over.
Yeah. Oh, good, thank you.
Yes.
Yeah, okay, yeah, appreciate it.
Yeah.
All right, so my phone says 10:01. Okay? Well,
I don't
let's get
do, I
going.
have.
Okay, let's get going.
Yeah.
And you're recording, you're all set down there?
Good to go.
Super. Welcome. Thank you all for coming to the August meeting for the Regional Coordinating Council for Greater Nashua. We appreciate everyone being here at the end of summer. And we certainly have a quorum here today, which is a great thing. Because we have Sandra online, we will have to do roll call votes. But let's go around the table and just introduce ourselves to kind of refresh. And so I'm going to start with Emma way in the back there.
Yes, Emma Rarick. I'm with NRPC and I'm a transportation planner.
I'm Sarah Caesar from United Way of Greater Nashua. I'm the volunteer director.
Mary Ann Gamache, Housing Specialist, Greater Nashua Mental Health.
Carrie Miller from the Nashua Transit System. Carol Brooks, SVTC.
Bill Air, Voices of Major Drive.
Marina Vaz Conservation Law Foundation.
And as Deborah said, I'm everybody. John Parade, Gate City Bike Co-op.
I'm Janet Langdell from SVTC.
Angelique Pandolph with Easter Seals.
Terry Palmer, I'm representing Manchester Transit Authority.
Deborah Z, Brandon State Independent Living.
James Wilkie, Carrier.
Anna Mikulino with Lamprey Healthcare.
Donna Masso, the Regional Mobility Manager for the RCC7 here at NRPC.
Hi, I'm Salem Quinn of the Administrative Communications Coordinator here at NRPC.
Hello, Matt Watkins, NRPC.
And Sandra.
Sandra DeLosa, Welfare Administrator for the Town of Merrimack.
And James Leach.
Hi, I'm Jim Leach with Harbor Care HVRP, Homeless Veterans Reintegration Program.
Welcome, thank you. And I see Mike's notebook and William's notebook. So Mike Appleberg is listening in at least, and William, that's yours, right? Bill? No?
Hi. So hi, Mike Appleberg with United Way of Greater Nashua, and Sarah will be our voting member today.
Okay, thank you, Mike. I always thought the Williams notebook was yours, Bill. All right, well, whomever. It's artificial intelligence happening. Maybe we need it today. Anyways, let's move on. We have the June 2026 meeting minutes. Everyone hopefully took a look at those. If you have any changes or corrections to make, we'd love to hear them. None? Anyone want to make a motion to approve?
I'll make a motion to approve the minute.
And second by? I got Bill first, sorry.
That's all right.
All right. Going around the room from voting, let's start with Sandra.
Yes.
Coming right around. Sarah?
Yes.
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 Yeah.
Dana.
Yes.
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 One of you guys.
NRPC is a yes.
There we go. All right. So we included in your packet this time kind of a follow-up from the June meeting. I hope everyone had a great July.
Yeah.
Surprisingly, though, July was a little busy, even though we didn't have a meeting. A lot of things happening in Concord that we'll get to later on in the agenda. Just to follow up, attachment to the memo, our meeting schedule. Right now, if you'll remember back in June, we talked about maybe going to an every other month cycle. And we thought, based on what we'd heard from the chair of the SCC, they were going to start their meetings in August, but they moved into September. So my suggestion is we just stay on every month from now till the end of the year, with probability of not having one in December, depending upon what happens with New Hampshire DOT and the next 2-year cycle application process for the 5310 RCC funding. And then in January, we can decide if we want to go to an every other month schedule. We've got things coming up. October is Community Transportation Month for the state of New Hampshire. We had already had something planned for that. We know in November that there will be some significant discussions at the SCC about potentially realigning the regions. So I think we probably do want to meet after that meeting. Just to see where we're at. And it may be that by that time, New Hampshire DOT, per a discussion that Matt was involved in earlier, oh God, it was last week. Or was it this month?
This week. Right.
Whenever, within the last week, they may actually have their application packets ready by the end of November. Probably not, but there's a possibility. So for that reason, I would just suggest that we kind of roll with it, if that's the general consensus. Anyone have anything they want to add to that? Yeah, Deb.
So I will just add that I am part of the leadership team on the SCC, so I can speak for them. The intent is to hopefully have a discussion in the September meeting about the realignment and a potential vote in November. At the November meeting. So November might be less of a discussion and walk away, or it could be a vote. But that's not set in stone that has to happen. It's just that was the DOT's preference.
That's part of the proposal. Yeah. And that adds to what I was gonna say later on, but I'm gonna encourage everyone to Zoom in. The SCC meetings are online. And we will send you out the Zoom link once we get it. And we encourage you to sit in and at least listen. Matt?
Related to the schedule, we have other monthly meetings here at NRPC every month, all through the year, and we've never officially taken, just assume we're gonna take July off or August off. It's never really been official, and it still wouldn't be really official, but I think it's a good idea planning ahead for next year to take July off from the, RCC meetings. And we kind of talked about some of the other meetings that everybody comes to every month. Maybe next July, just kind of taking a break, kind of really planning on that. So, I just wanted to mention that for next year, that I think it was good to have July off, RCC.
Well, and if we get to an every other month cycle too,
Yeah.
hopefully, it probably would be the July meeting because June would be the annual meeting.
Yeah.
July off, come back in August. But let's see what happens with the SCC and their cycle too, because I think the point we made at the last meeting about making sure that we're meeting, if they meet the first week of the month, that we're meeting later in that month so that we're not delaying things for an entire 8 weeks almost.
Yeah, and plus there are times when some of our committees have to meet because we have to do some sort of some sort of adjustment to some federally required document. So never a sure thing we can take a month off.
Mike, I'm gonna get to you in just a second, but if there was an emergency of some sort that this group needed to take a vote, we couldn't get everyone together, the executive committee can act on behalf. So we're kind of covered there. Mike, online.
Yeah, so in order to not delay things, these same issues.
I think you're breaking up, Mike.
Yeah, you might.
Sarah, if he texts you the information, let us know.
So the only other thing that I don't know all the bylaws. So the bylaws is there anything in the bylaws that say we have to meet X number of times per year?
Yes, we'd still be meeting that though.
Okay, and then the other thing is whether or not the bylaws allow for an electronic vote of something that needs to be voted on.
I don't believe that they do.
Yeah, so that just might be a way to, if people, making sure a vote happens if it needs to happen.
Right, but the executive committee can also on something.
Yeah,
that
they
we've
can,
already
yeah,
discussed,
depending
so.
on when does the bylaws then say it has to be ratified by the full council after the executive
I
committee?
don't know that it spells that out, but certainly we had talked a couple of meetings ago about taking another look at our bylaws now that we've had them for a year and a half, 18 months for tweaks and that. And I don't know if any other region's hitting some of that or not. Ours are pretty much the template that was provided by the SCC. Hey, Rocky.
Good morning.
So this is Rocky Morelli from Opportunity Networks.
Good morning, everyone.
Morning.
Salem,
Thinking about from now until the end of the year, I believe you were saying that we'd want to meet after the SEC's November meeting. Do we know the date of that meeting? Because if I'm not mistaken, right now, our meeting is scheduled for like Thanksgiving, I think, or it's usually.
I have to look at that. Yeah, we can look at that later on. Yeah, but we're gonna meet in November. I think we're gonna have to.
Either the 5th. Salem, it would be November 5th.
Yeah, it's the
November
first,
5th
it's the
would be
first
the
Thursday in the month.
Yeah.
We can circle back to that, but yeah, we would have to meet.
Thank you.
All right, so just running back through the memo just a little bit more, just to let you know that the third annual Greater Nashua Community Transportation Hero Awards, we're looking for nominations. We'll send this out again in a follow-up email. We would appreciate receiving nominations from the group. Somebody that you think, and it could be a volunteer, a staff person, an agency, an organization outside of our table that is supportive of community transportation in the region. That could be a group that keeps funding something that you're doing with your program around transportation. Our last two have been, last year was John Burkett. Posthumously, he's the founder of the co-op, the bike co-op. And prior to that, it was Lori Lorman from Nashua Transit for her 40 years of service to community transportation. So the executive committee will be accepting those nominations, and easiest way is just email them over to me. I'll compile them. And I'm langdale508@comcast.net. And if we can get those by the end of September, Tuesday, September 29th, that would be great. But we'll remind you of that. More info, the community transportation needs assessment that was done by the New Hampshire Council on Aging, or Commission on Aging, has been circulated, presented, put out there. They did have, and this is an additional piece that we will send around, but you have copies here. Able New Hampshire had a session a week or so ago on that. They actually have posted the Zoom session. It's on YouTube. The link is here. There are also links to both in that handout and on this document, except page 2 is not here. Oh, page 2 is right there. To the actual report and the summary and the executive summary. So I would encourage you to take a look at that. There are a number of recommendations. And the findings, while they may not have been earth-shatteringly new, they certainly do support many of the things that we've heard from all of you and we've all experienced regarding community transportation. Did anyone else want to add anything on that? You guys, from what you've heard at the SCC?
Yeah, nothing different. We had a leadership meeting yesterday and it was mentioned that it's out there. I ended up having to leave the meeting. I left the meeting on time. They stayed much longer than I was able to stay. And the discussion that was happening when I was leaving was, does the SCC or Transport New Hampshire want to send out an op-ed or something like that to get this more visible to people? So that's a discussion that was happening yesterday. And, you know, I would support that, getting it out there. I don't think it's out there enough for people to, you know, put it together with the veto that happened the other day in the transportation highway. So I think
The overturn of the veto from the governor.
I like the veto over the veto. But yes, I mean, talk about politics actually working, but so we did talk about it yesterday. I don't know what their outcome was, if we will, you know, author something and put it out there as an op-ed or something about the report.
If there's, if there is a press release type thing.
Yeah.
Certainly share it because
Oh,
we
yeah,
can
yeah.
work with the National Telegraph, the Milford Cabinet, and a bunch of the local papers. And certainly the Monadnock Ledger, which is an excellent paper. And the last thing in the memo has to do with a fiscal report from FY26. That's this, I don't know if you can pull it up, Matt, or not, or Phelan. It was in that PDF. This lovely colored grid, which basically summarizes the quarterly expenses for each of the programs that were funded by the 5310 RCC funding this year. That includes Sweegan Valley service provided by Nashua Transit, the Greater Nashua Community Rides program that was a pilot last year. Additional funding for caregivers on an administrative level in order to secure volunteers. Again, NRPC's contract management funding, and then the regional mobility manager. And I note again, just so no one gets scared, the amount in this part for the regional mobility manager is not all of her salary. The other part of that comes from the NRPC's UPWP, which is their funding through New Hampshire DOT. So it's a split source for her. But just so that's there. Everything came in slightly or under budget. So there's these funds from this year will roll over to the current fiscal year. However, in June of 2027, if the funds aren't spent, they go back to New Hampshire DOT into the pool.
Can you
No,
remind me what our fiscal year is?
July 1 to June 30th.
So thank you.
Welcome. I will tell you, and I'm not sure if we got it stuck in any other place. Based on the discussions with the Hampshire DOT earlier this month, they are sticking to their guns that Region 7 and Region 8 will see a reduction in the overall funding under the 5310 RCC allotments. The way it was presented to us is there's going to be a 5% increase, but we're starting for year 2 regions from the original amounts that were allotted, not the bridge amounts. So we got a little bit of extra money. What this basically is going to mean for our region, we think right now, unless things change, and we haven't heard anything concrete, is that this region's allotment will be about $40,000 less per year. So that's going to be something that we're going to get harder numbers from the Hampshire DOT to start sitting around the table and talking about what we're going to do. So any of you that have irons in the fire, start thinking about how your funding is going to look. And I know this comes at a very difficult time for most of us because we right now have to be going to our towns and asking for the amounts that they're going to vote on at their town meetings next March. We can't wait to ask for that money until December or January. So pardon me, and you can put this in the minutes if you want. It comes down some days to being a crap shot. Mike.
Yeah, just a question about that reduction. Is that based on population trends, utilization rates, or just overall budget reprioritization?
It's a historical piece that's been hanging out there for years, and it has to do with the fact that Nashua has a UZA. Nashua gets federal funding under the 5310 program that is divided between, correct me, Matt, if I'm wrong, because this is your ballywick, is divided between Manchester and Lowell and Nashua. So they do get a certain amount of 5310 federal funding. And because of that, New Hampshire DOT has always kind of reduced our amounts quite a bit.
Right, so there's the urbanized area is a direct recipient of 5310 funding. And then the RCCs are recipients of 5310 funding as well, but it comes through New Hampshire DOT. So whereas, yeah.
And they consider that more the rural funding. So again, we're doing this rural urban kind of thing. What you have to understand though is the UZA and the boundaries of that they look at for the population trends. Basically, where's the map?
It's right there behind.
Right there.
The gray, I guess.
All the things that are kind of blue on that blue-green color is the Nashua UZA. So just think of it as a big swipe that comes right up 101A to Milford and goes a little bit into Wilton. So that population is counted towards the Nashua UZA, and New Hampshire DOT makes a reduction in our overall regional population based on the algorithm that they have in play regarding the geographic areas that are supposedly in the Nashua UZA.
I just have a clarifying question about like the conversation that was had with DOT and the 5% increase over the original thing. With that 5% increase, it's still like ironing out to the 40,000.
Yep.
Okay.
Yeah, because remember the two RCCs, they were gonna lose a lot. And then Fred found.
He did a bridge.
Yes. Yeah,
He did
I know,
a
I
bridge.
know.
He did a bridge for 2 years to
Yes.
put us, we'll give you this money now, but you gotta get ready for this coming down. And we knew it. And we've been talking about it for a while, but again, this conversation comes within a week or so of getting the Hampshire DOT's proposal about realigning into counties. And if that happens, then we have no idea what the funding is gonna look like. To really mess up the picture in the discussion and make it wicked confusing.
Thank you.
Good answer?
Is that a segue? Yeah,
Good. Is that segueing enough?
I don't know.
So I share that with you. I think that the upshot of all of this, and I don't have all the numbers available for all the rides that were provided under this funding, but I think the upshot is that the community rides program provided 94 rides this year. You know, and there were 49 events, if you will, ride events, but actually for one-way rides, it looks like it was like 94. While Nashua used the most of the service for rides within Nashua, there were a number of rides that were way out of our area. Lebanon, New London, Hinsdale, Salem. So again, filling the gap where it's needed. We're also able to provide, thank you, Donna, you know, rides for some folks out in Lineborough that have no service whatsoever. And many of those were simply to get to medical appointments in Milford and required wheelchair transportation. So there are some success stories here. But that did come in a little bit under budget, so we do have some funding left over for next year as well. I think it's a good start. Anyone have any questions? And I know that's a lot of blah, blah, blah. All right. When we get those numbers totally in, I will ship it over to you just so you can take a look, comparison between this year, last year, and hopefully the year before. All right. Is that our segue? I think that's our segue. Any questions at this point? Does anyone need a drink, a snack or anything? So the next thing on the agenda is the actual proposed SCC realignment of the regional coordination councils to county boundaries. We wanted to provide you with this information because it is now put on our horizon. And in your packet, we included the original email and proposal, as well as the first response that was received by this group. In addition to that, there was a very articulate email shared by Scott Vogel of, he's Rockingham, right? Rockingham RPC. That basically said many of the same things that Rad said, and then some more detail from a planner's perspective. So Matt, I'm gonna now turn this over to you.
Oh. All right, well. So.
We're into the MPO stuff, so.
Well, so the attachment 3, I think you just said that kind of lays out what kind of what Janet was saying as far as these boundaries. You know, there was an email from Fred August 3rd. And that went out to various people and such, and it certainly caught me by surprise. I heard nothing about it, that they were considering this. So you know, so it was a surprise. And then it did generate some response from various folks, you know, and again, in the memo, it mentions Rad Nichols from over on the Seacoast, but it had some very good points about why was it a good idea, you know, pretty, you know, good points and very much not in favor of this proposal. And so in kind of, you know, to what Janet was saying, we wanted to bring this to you all because we want to weigh in on this, I think, to, you know, whether we're in favor or not. And Angelique, I see you wanting to ask questions, so go ahead.
Yes.
No, we want Angelique's input on this.
Yeah, for sure.
But you had some perspective too from Region 8 and Region 10.
Yeah, so, well, I had a question that if so I'm an SCC council member, right? So I'm trying to understand everybody's feedback so that I can make a, proper informed vote on behalf of what makes sense for the regions based on the feedback. But I was interested if, I believe there was supposed to be like a conversation with the RPCs about this proposal as well. And so I was curious if you had information or feedback on that, like on behalf of the RPCs, what their, feelings about the proposal.
Right, Fred and Bill Watson from the DOT did bring this to the RPC directors, and the directors meet monthly.
Yeah.
And they talked about it, and my understanding was there weren't any directors that were in favor of this. So I think the RPCs have one vote on, I believe, on the SCC. Our executive director, Jay, happens to be the current member.
Well, hold on a minute. As person on the governance committee, I have not received that he has been officially appointed.
Okay, well.
So he may not have a vote.
Okay.
I just want to be
That's
clear
a good
about that.
point. That's a good
Yeah.
point. No, because
Yeah.
we assume that when Sylvia retired.
No, he still has to be appointed. And
No,
yeah.
that would actually happen kind of.
As of a couple weeks ago, when I emailed him to ask him if he had his appointment yet, he did not have it.
Okay.
So that I can tell you. So just.
Very good point.
But Matt, you do have two other SCC voting members here. And I'm in the same boat as Angelique. And when this came out, I got many emails from SCC members and non-SCC members kind of putting me toe to task and saying, how can you guys approve this to go through? And I said, whoa, wait a minute. The SCC leadership did not approve this. We got the same email you got. We did not approve this. So I want to be abundantly clear about that.
Yeah.
What we said to Fred was, sure, you can bring it up at the September meeting. We can add it to the agenda. Yeah. So I have been, like Angelique, I've been to 8, I've been to 10, I've now been to 7, I've been to 3. So I at least have a little bit of feedback that I know. I was curious to see what the RPC said about it as well. Because if I were to vote in September, my vote today would be no or an abstention because I don't know enough to vote. So we are seeking information, like what is it we need to hear to make an informed decision?
I'm going to slide this in.
Yeah.
In a follow-up email, Fred Butler did admit that he miswrote his email.
Yeah.
That it was premature, that the SCC had not approved. This was not a recommendation from the SCC. This was simply a proposal from New Hampshire DOT. Now, what drives that proposal, if it is simply, doing data analysis on their end or something administrative on their end, that's one of my questions.
Fred Butler,
for New Hampshire DOT.
Yeah, why'd this just come out of the blue?
Well, and then I was wondering if there was some kind of recommendation from the CTNA report to go to a county model, and I couldn't find that in there.
It came up in there. According to what I heard yesterday, it came up through the CTNA, but that wasn't the reason for doing this, because we didn't even actually get that report till after Fred's email went out. And I'll recommend the same thing that I recommended to the 2 other RCCs that I sit on as a voting member is, so Rad's email was precipitated because he had actually sent that entire thing to me on August 3rd. And I was like, Rad, I think you need to clean it up a little and send it to DOT. And I would say the same thing here. I think if we have questions, whether they're from Rad's questions and dovetailing that, and I did tell Fred yesterday in our leadership meeting that I was coming here today and I'm going to make the same recommendation that I did with the other 2, and the other 2 have sent him something. And that is, if there are questions, give them to him now so we get more information on September meeting. Mm-hmm. And I don't know what those questions are, but I do assume we have some, like just that, like what's driving this? Is it data? Is it utilization? Is it, Fred indicated yesterday that he actually talked about this a year ago. I'm going to be perfectly honest with you. If he did, it was like over this to me. And I'm like, oh, that's not something I need to know because I don't do transportation anymore. But so I think those are valuable questions, like what's bringing it up? Why is it bringing brought up now? But the CTNA did not drive it. there was feedback, Jen Huto did provide feedback that it had come up, I think more like at some of the hospitals. Because there are a couple of cities and towns that are outside the actual county, that they're being served in.
Mhm.
So.
Go ahead, I was gonna.
I have a question for Matt. In the conversation with the RPC directors, was there any conversation about realigning the RCCs to match the RPCs? Because that is one thing that Fred and I have talked about for 3+ years. Was because you've got, and I used this example in the Region 5 meeting the other day, is you've got this little tiny town Ware that sits right in the middle of Region 3. So you got Ware and Region 3 is all around it. And it's just kind of like, it's these little border towns, and that's kind of what I think came up in the CTNA, is these little border towns get forgotten about. And so Fred and I have been talking, like I said, for years, that maybe the lines need to be readjusted to put Where in Region 5 instead of Region 3 and these type of things. So I'm
And you got
wondering.
Hooksett, who's not a
Right.
small little town,
Yep.
who's, in one county and serviced by another
Yep,
county.
exactly. So I didn't know if maybe that was brought up.
So I wasn't at the meeting because I was away.
Darn it, Nat.
So I can't say, all I know is, what I know is that there wasn't, that might have been talked about, but I don't know. But Jay didn't tell me how he would vote if he had a vote, but the consensus was.
RPCs can realign, and we've done it here. Years ago, Mason decided that they didn't want to be part of Southwest anymore because their focus is here.
Right.
So they actually petitioned to join our RPC as opposed to the one over in Cheshire. That kind of shifting can be done, but I think it depends on the focus for many other things within the community and not just community transportation.
Yeah.
There's some other implications there.
Right. Well, that's
That
why.
piece of it.
Right, that's why in the conversations that he and I have had in the past, if we're looking at transportation and transportation funding through RCCs, then it would have made, maybe it would make more sense aligning with the RPCs, because you guys do so much work with everything transportation. But I don't know, I'm not familiar enough with other programs where if the RCCs realigned with RPCs and not county-based, if it would, I don't think it would bother any other programs. It wouldn't upset the apple
See,
cart.
and that kind of realignment really wouldn't impact us because we include all of our 13 towns anyways in our RCC. I think the greater impact is further north.
Yeah, so we'll see what happens.
I'm trying to think of what the question was I wanted to throw in there. Oh, so my concern when I read this originally was the lead agencies. In Region 8 RPC, Southern is the lead agency for our Region 8. NRPC is the lead agency for Region 7. To have one of them have to take on the entire Hillsborough County, it just seemed more than was needed, especially if within that document proposal, one of the pillars was to be better able to leverage county funds. Well, if that's the goal, then I think it behooves the SCC to support the regions collaborating together to say, okay, we have these towns in your county. Let us all go together. Let us get in touch with our, state representative delegation to the county and our county commissioners and make a pitch, but make it so that we need to do that and come together on it, because that gets to the boundaries crossing relative to transportation. I mean, caregivers is a great example.
Coordinated transportation.
Yeah, so support the local coordination. Support our statewide regional mobility manager program that was supposed to, be the end all be all and move this forward. And, let's not ignore that.
Yeah, and also administratively, there's oversight that has to happen. There's risk involved there, right? We pass through funding to all of the different programs you see there. We have to, that you see on the annual funding report. So we have, there's a responsibility and a risk involved there with being a lead agency. and time involved. And if you went from having to oversee 4, subrecipients, and you went to 8 or 9 or however many, that now you're talking a full-time employee potentially and more risk. So that's a downside for a lead agency.
But more risk, but also more cost,
Yeah.
not just from getting reimbursed through the the RCC funding, but also just it's time materials. I mean, you may have to hire another staff person to do
That's what
that.
I'm saying.
Go ahead.
Yeah, and to your point too, it's like we're creating like additional regions if we were to do this with the counties. So it's like that's even more like administrative pressure on, like as a member of the SCC and our goals to try to be, engaging with all the RCCs, that's more RCCs, and also like mobility managers, we need additional mobility managers, right? But I can't
keep all
imagine
staff now.
one of mobility manager handling like all of Nashua and Manchester. That just seems really.
But no. All of Nashua and Manchester and every town in Hillsborough
Well,
County.
that's what I mean. I
mean,
can't
trust me,
imagine that
this
that
is-
would
this
be
is
manageable
not
for
simple.
One mobility managers.
Yeah,
right?
this is not simple.
Yeah, do you see any benefit of the recommendation?
The benefit of the recommendation, I think, is to fire up more collaboration between the regions and the RCCs. And that's one of the goals that we have is to, improve that collaboration and communication. Again, I think the point of the county funding, great, okay, let's do it. I mean, I know some of the delegates from the State House that come from my area that are on that committee. They've done some great things for our library. Great, Region 8, you got some ideas? Cheshire, because you cover some of the towns here. Let's put a package together and get it to them. I see that as a prompt for maybe change in a different direction.
And what I heard yesterday, because one of my concerns, and again, I want to be abundantly clear with everybody here. I don't live in the space that all of you live in every day. I live in it very little, but one of the things that I said to Fred, well, when would this be effective? And he's like, the run time for this could take a couple of years, is what he said. So it's not something that it would be voted on and then implemented for.
Well, he hasn't said that to anyone else.
It was literally, I asked the question yesterday. So I think, and I said to him, I said, I think you need to make that point at the September meeting. Because if there's a runway, we're not just doing this because I would assume, I don't know, that you would want to start it in a biennium. And that biennium is going to start next July. I said, are you going to be ready for that? And he's like, no, the runway for this would be longer than that. So that's what he said yesterday, which did make me feel a little bit better that we're not rushing into this, that we're actually making it, talking about it and making sure the right decision's made. And the time is given appropriately to do what has to be done if it's changed.
Well, that's really good to hear because seriously, when, you get this and we were in the other meeting, I'm going, oh my God, I've got to go to Brookline, Amherst. I've got to go to my 6 towns, ask for money for next year. I have no idea what it's going to look like. And if we realign and the whole funding pot scheme changes, I don't know what our little organization representing 6 communities is going to do. We could be no funding. And Nate Miller was very clear that, going back to the reduction in funding, he said, you have to understand that with reduced funding, we all may have to reduce service. Go ahead, I'm sorry.
Yeah, and one of my thoughts about this was, I don't know if it was prompted because of like the RHT and how, like, I know for like Title III funding, that's like per county. If this is supposed to be like, an effort to try to work like grade or, combine and coordinate funding, I'm like that.
That was the other question too, and I don't know that when it was kind of mentioned, it was glossed over. I don't remember him saying anything specifically about RHT other than we won't know anything until they open their discussions in November.
Right.
So again, if there's a thought underneath the surface at New Hampshire DOT around that, it wasn't verbally expressed because I think they're all waiting to hear from DHHS in November. Yeah, babe, I saw your hand.
I don't quite understand.
Hold on, folks.
I don't
Here we go.
understand what funding is available at the county level, so I'm speaking blind to that. So maybe there's something there. And Angelique just kind of hit upon what I was thinking. usually when you have these reformations of these types, there is some level of efficiencies that get created. And I haven't really people talk too much about that. Could there be savings in places or better utilization of resources? And then the other area I think you might see some activity is a more equitable distribution of funds. I mean, to me, you're putting the two big regions together with a lot going on. You know, is it gonna make it more competitive and more economical for people to kind of get involved at that level? Might you see service providers within Manchester and Nashua maybe overlapping or merging more? Or, you know, do you envision kind of those type of trends down the road? Because I think it opens the door for those types of things.
I don't know. I wish I knew more about like what prompted the.
I think people should keep that in mind when they're looking at it, though.
But no, I mean, I think these
Those
are all
might be
like.
places where it
valid
actually
questions.
rubber meets the road type things, dollars and cents.
Well, and that's the other thing too, is obviously, like you mentioned, it's gonna be a long, like, time before, if anything was ever actually implemented, but I felt like it was a little strange to like even put out the proposal with kind of like no information regarding like how this would change funding. I mean, that's everybody's number one question, right? Like,
And the whole urban issue, there's a distinct difference between what Manchester does and what Nashua does, you know. I'm still trying to wrap my head around the difference between the transit authority and other types of options. And they're all going on and they all overlap and interweave and funding goes in certain directions based on previous decisions. But I don't know, as an outsider coming in, I could almost make the argument of kind of where things could be aligned differently and work differently. And I think if you open up Hillsborough County as a single entity, I see those types of issues occurring and kind of turf wars happening over resources, which could be fascinating. It's fun to watch as an outsider.
Sitting on that.
It's not the Yale School.
I won't have to do it.
It's not the Yale School of Organizational Management, okay? I mean, really.
I'm just thinking out loud a little bit, but this is
Yeah,
pretty
not-
big.
I mean,
Matt.
Sounds like the Hunger Games.
just, I think if a pro to doing this, obviously would be if there's some pot of money that will appear. And I don't know, other people know better than me, but the only pot that I see even potentially is the Go North, that funding that they're gonna talk about in November. But there's no, other than some pot of money that I don't know about. There's no extra money that I'm aware of that would make this be some, you know, amazing opportunity. So unless it opens up a bunch of funding, I don't see it. We know you can't take on all this additional responsibility as a lead agency, for example. Right now, what we know, there's no extra money. There's less money for our reach for Region 7 and 8, or there's less money.
Right.
So so unless this is opening up some other massive amount of money that's out there, I don't see a reason to do it.
Or is there? a
And I have not
different
heard that there is.
Yeah, and if there's a different approach to this massive amount of money, again, I go back to this elaboration versus realign.
And so this is
Yeah.
just an observation, an opinion, not a policy of any agency that I'm affiliated with at all. But we live in a time in this state where basically the legislature doesn't want to pay for anything, even stuff you use. So, you know, at least for the near future, there's no options for additional funding.
Yeah, and you know,
My opinion.
I think we all come back to the rural health transformation multi-million-dollar grant the DHHS got. And I'm gonna be honest with you, every time I go out there, when they send me these Go North emails, I don't know how many of you are getting those or on their subscription list. and it's a grant for this, and they say, well, go here, you can look to see if you're eligible, and I go there. And I click on it, I just click on it to go, what towns are available, and I'm going, well, now Lineborough isn't counted as rural in this particular instance. I don't understand it. You know, I'm not really looking at the whole thing, but you look at Hillsborough County, I mean, they had some really weird places that were considered rural. And I'm going, but that's right beside Bedford. So again, go ahead.
Yeah.
And then I want to go to Carol out on website.
Okay, yeah, I was just gonna say, as far as next steps, I think at some point we would probably want to endorse a memo or a letter.
Yeah, well,
But we might want to wait. until
Can we circle back to that?
Yeah.
Let's see what Carol has to say. Hi, Carol.
Good morning. Can you hear me okay?
Yes.
Yep.
Great, thank you. My apologies for coming in late to the meeting. So I've been reading over this proposal and I focused on the streamlined allocation funding based on census data that is in the pro column for how this would be allocated versus going by town level data into the current RCC regions. My question has to do with similar states to ours in size. So I'm thinking like Delaware or Rhode Island or others. And if there is something that can be looked at to see how other states, if they utilize county approach for their 5310 data and funding allocation, and if there's, you know, pros and cons to how they're doing it. I'm just going out on a limb on this and wondering if it's even worth exploring, but I just thought I would offer that up as a question or for commentary. Thank you.
Thank you. It's a good point. I still would add to that, knowing that, you know, this realignment takes Region 8 and 2 major urban centers that are under this UZA. You know, if they're still going to then have to play with additions to a straightforward algorithm by county to remove that population. Again, that doesn't simplify necessarily the work the New Hampshire DOT would have to do. What does it add to it? Go ahead, Terry.
So Carol just sparked a thought. So we all know that, well, maybe not everybody, but Vermont receives all of their federal funding, and then they have to provide all of their transportation. So they have to provide their Medicaid transportation, so on and so forth. It all flows through VTrans. In the CTNA, that's one of their goals, is to have better coordination at the state level. So that way the federal funding coming in doesn't get all split up and spread out and maybe not spent, or, you know, you have all these reports that you're reporting to the same people. So they're trying to streamline that. So I'm wondering, now that Carol just reread that, I'm wondering if this has something to do with what the Go North folks are maybe potentially rolling out. I mean, we know that there's no guarantee that any of the funding will come to transportation. They're having conversations about it. There's been speculation that there's a pot of money set aside for transportation, and what does that look like, and so on and so forth. But I'm just wondering now if this is some master plan behind the scenes that
But isn't the pot of transportation funding going to UNH? Who have their own kind of transportation because it's UNH, but are they involving the SCC, the RCCs, the RPCs, anything like that? Like, I think, I think people are holding too much weight on what's gonna happen in November.
Yes.
I just do. I think we're all talking about November. I'm not talking about November. I don't think November is ever gonna come. I think the fact of how this CTNA came out, the highway transportation, the Go North, all of that, I'm not confident that transportation is part of that. And for us to kind of be hanging our hat on what's gonna happen in November, I think we're gonna have a lot of disappointed people.
See, I take it, Carol, I'm gonna circle back to you in just 1 second. And I'm taking it as there's a set of recommendations from the CTNA. And there's this stuff going on over here with Go North. If New Hampshire DOT is taking seriously the statewide community transportation assessment, and they are looking to the future, are they willing to champion and work with the SCC to get this 1 point of money coming in from federal for transportation, so that it's not divided up between DHHS, BEA, blah, 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 blah. So it funnels through. If they're looking towards that, if that's the long-term goal, then give us the whole plan. Let's
Exactly.
see where we're going
If
here.
who is-
That might make more sense.
If who is DOT or, yeah,
DOT in collaboration with the SCC.
Yeah.
And everyone else, because everyone's supposed to be at the SCC table, according to the RSA.
Yeah.
If that's the long-term thought to improve community transportation, public and private or whatever, within the state of New Hampshire statewide, then,
So it sounds like we'll get more information at the September meeting.
wait, I would like to go back to Carol since she started this flow of conversation. Carol, what's up?
So thank you. I'm really looking at this as, again, long-term coordination on federal grant funding. Centralizing it into one agency that receives the funds and has a collaborative relationship with the other government, so like you said, DHHS and others, to look at it from, what if federal HHS has funding related to transportation and public wellness and such. The mere thought that it's transportation, tips me to say, okay, then that should be a DOT with working with the FCC and others to say this money is coming in from HHS, or this money is coming in from Homeland, or this money is coming in from agriculture, and it all benefits transportation at some level. Having, one focused entity that says the money comes in here, and then we collectively decide how it gets distributed based on the census data that is provided at county level. And then within the county, they work to determine how best to address rural and urban, if the county is, has a delineation in regards to that. So I can see the benefit of going to a centralized hub for the state. And again, I would say, how have other states in a similar to New Hampshire approached this? Vermont was a good example of where that could potentially be. I'll yield. Thank you.
Carol, exactly what you're describing is what the state of New Hampshire implemented through the State Coordinating Council for Community Transportation as a central hub for kind of driving this process. We just haven't had the funding coming in to be able to dovetail it and braid it. So again, I think one of those pieces is there. On a very personal note, though, I just will say that unfortunately, in my lifetime, the strength of our county system has dwindled from what it was back in the 50s and 60s. So decision-making on that level is kind of questionable too. And I think that point was brought up either in Mr. Vogel or Mr. Nichols' comments as well.
I like the model that Carol's kind of framing things in, and Terry as well. I would like to kind of go a little deeper and specifically ask of the group that's looking at it, with the streamlining of these services as they present it, will it reduce administrative functions? Possibly change regulations? Because one of the big concerns is that the system can't handle the additional workload. Is there a way to reduce the reporting and the workload? Seems like a lot of people are putting into it. And streamlining, could that be reduced or kind of streamlined itself? The other area I think is important to ask, is there any feeling that this realignment would help address unmet needs or services or priority areas that we're all setting up and finding frustrating and not being able to get at it. So the three areas I think that could be important is it would create funds. Nobody thinks that'll happen. That it could reduce administrative oversight and responsibilities, which gets more efficiency out of the dollars you have. And then just addressing our priorities that we've all set up on individual regions. And there is a lot of overlap amongst the regions. So if they could specifically address them in that framework as Carol's kind of presenting, or made me think about it.
Very good point.
I think
Carol,
that'd be
I'm gonna
helpful.
swing back to you.
So as I'm looking through these notes, although the con is increased administrative load, as it was just stated, there's a potential to decrease the load based on the money that comes in and the agencies with programs that are impacted. And it would just in my mind, there may be at the beginning some increased administrative load based on change. You know, it happens. It's a Murphy's Law thing. But that doesn't mean long-term that administrative load is elevated. If in centralizing the money that comes in and dissemination to the applicable programs, at least those programs know what to expect and not have to be bartering for this, that, or the other thing. So I'm not saying that there wouldn't be an increased administrative load, but initially there may be, but with time as things are settling, and all of the various agencies with funding are collaboratively participating, that that would decrease. Thank you.
Thank you. You know, and for those of you who don't provide transportation, you certainly have clients who need transportation. So this does affect all of us. It affects our communities, it affects our clients, it affects our neighbors. My suggestion, I'm gonna go now, I'm circling all the way back, Matt. What?
No, I just wanted to say something. Go ahead.
Well, why don't you go ahead?
No, just to Rocky's point about, you know, these communities that might not be served, no matter how you line it up, services that are available are the services that are available. It's not going to make a difference. I mean, where is a hard place for anybody to get to because it's so spread out.
I just want to hear them speak to it.
But the point is, though,
now's the time that
if where becomes, you know, is where in Hillsborough County?
Yeah, it is.
Okay, so I'm not going to go out to where if I don't have to. It's too far for my volunteers.
You're not even gonna go to Lineborough.
But the whole point, that's just it.
Yeah.
It doesn't change anything as far as who's getting service.
So I'm circling back now to what Matt started to say before, that we were both thinking on the same line. If possible, I'm looking at the calendar, you know, their SCC meeting is on the 3rd. So it's like in a few days. If we can get the minutes to this, Matt, do you have time to work with me to maybe take the information we've talked about today and put it into these are the initial questions and thoughts from Region 7, and get it up at the beginning of the week to New Hampshire DOT?
Sure.
And then I would ask you, as you drive home today, as you sleep on this, if you have any thoughts about this between now and Monday morning, shoot us an email. All right, and we'll include that in the memo that we send up to New Hampshire DOT, or the letter or whatever.
I would make sure the memo asks a question about the timeline.
Yeah, oh. Implementation timeline, right there.
She's on it.
Yeah.
Sounds to me like
Is
it
that
should be-
feasible in your schedule? I mean, I'll adjust
do it
so that
today.
we can work together and get that done. Okay. Thanks, Salem. Thanks, Matt.
Yeah.
Unless anyone has anything else.
Could that also include an evaluation piece as to how are they evaluating this whole concept, and over the course of time that this would be rolled out? I'm a firm believer in having something measurable performance-wise, so I just throw that in for good measure. If it's applicable, great. If not, put a parking lot and put a pin in it. Thank you.
No, actually, it's really good because, I mean, they're all about outcome measures, even though their outcome measures may not measure anything at this point. But any implementation plan has to have an outcome evaluation. And thank you for reminding me of that. I got it written down.
By the way, the more we talked about this, the more I see some sort of ad hoc committee of SCC or some sort of study about what the pros and cons are. I mean, I don't even know has anybody talked to the counties about this?
Has anybody talked to?
Has anybody talked to the counties? I think this.
That's a good question. Have you talked to the counties?
I mean, this sounds like a 6-month to a year study about how this could work and how it can.
And what's driving this at this point in time?
Yeah.
Is it the CTNA?
Yeah.
Is it the RHT? Like what's driving it is, is there federal issues aligned with the federal funding? Like what is driving this? Because, and again, I don't sit in your chair, but the one piece that I kind of caught my eye is the whole, mobility managers being shared. And, that could significantly reduce cost.
So what are you gonna share mobility managers?
This is what I think those types of questions need to be, is that you indicate this is a possibility. Can you help us understand how that would happen? What is the rationale behind that? Because again, you have, you look at Coos County, which isn't necessarily population-driven numbers relative to Manchester or Nashua being disproportionately shared on people. Coos County has mileage, ground transportation, maybe not people numbers, but here you have people numbers, which is going to drive a mobility manager more than mileage is. So I think that those are the questions, like, what was the study that made you make this statement? Like, what is the backup to this statement? Where is that derived from? Like, I think I would be that bold and ask. So you make this statement in paragraph 3, what is the supporting documentation for that? Is it just because, well, I'm just thinking if we do this and we do that, you only need one mobility manager. But what's the rationale behind it?
That's a great issue.
What's the number of people Donna and Nick Alfonso are now servicing versus Candy Reed? And I'm not putting Candy Reed. Don't please read this into anything other than the number of people.
And
Wildly different.
my last thing is just like from the client, like person in need perspective, I mean, how is this benefiting them, right? I mean, I guess in the proposal, it says like it'll be less confusing for people, but I feel like a lot of people like may not even know their county. So I don't know that that's really like a win.
No, they might know they're in Hillsborough County, but they have no idea that they can call Bob Rowe or whoever the county commissioners are, or where the county office is. How do you contact the county? You probably,
Everybody goes to the library or the town clerk.
when, and I'm.
I never think of the county. Ever.
But see, I'm gonna go back and just say I'm a little bit biased here because from my previous statements. My father was a county commissioner back in the 50s and the 60s, late 60s. And they had regional offices. They were out and about. Now, I understand that that's, a long time ago and times have changed. But I don't feel that our county system in the state of New Hampshire is as strong as it was or is as strong as it is in other states. And I think that's where we have to be careful in terms of comparing state to state. We have not relied on our counties that much in the last, oh my God, I'm showing my age,
Few years, last few years.
Just a quick comment. I think Deb's point is really important. The value of the mobility managers. We're talking about reducing them, but no one's talking about what its worth is and what impact that might have.
Oh.
It speaks to Angelique's point. I think if we kind of reduce them down, the people sitting at home are gonna just be more confused, more people without contact.
It's funny you mentioned that. I was gonna keep my comment to myself, but something,
Since when?
yeah, I know. That's why I'm speaking up. So if you read the CTNA, and I mean read the CTNA, my impression, just my impression, is they want to take the mobility manager network, move it into DHHS, and I'm not even sure what they want to do with it. Have you read that?
Well,
No?
wasn't making the regional mobility manager some type of mobility manager within the hospital systems,
Like caseworkers.
caseworkers
Yes.
within the 11 suggestions that were made to the
Yes.
RHT.
And then
Again,
there'd
we
be
never
more-
saw a copy of those. We were never presented with a copy of those, but it's by listening and
Yep.
trying to understand what people are saying. That's what it sounded like.
But in the state of the state, I don't think that's ever gonna happen. I mean, look at the regional mobility manager, the state mobility manager now, DOT won't even hire them. They contract it out.
Right.
They don't want that
So this network.
in their office.
So this network that was supposed to lead us in developing and strengthening our community transportation system in the state. The regional mobility manager statewide network was supposed to be doing that. That was the strategy, has not been supported sufficiently.
Exactly.
So I just like winced when you said that. I'm just like, look at the state of like Medicaid transportation.
I know.
Yeah.
Under DHHS.
Right. So I don't
I
think
know.
that will ever move there, even if the CTNA recommends that, because I'm not quite sure the governor's even bought into the CTNA. I mean, you know, that's, so I think we have what we have.
Yeah.
But
And
I
it's
do
years will
think,
go by quick.
yeah,
They've got to do a lot in 5 years.
I'm gonna switch over to Carol for a minute here.
Just have a comment regarding census data, and I don't have the numbers in my head. I think most of us realize that the elderly population is growing here in the state. So a potential positive of this, if efficiencies are gained, maybe more clients can be served. But in the present information that we have, that is not even mentioned. So I think that's an important.
It's administrative. It's administrative oversight and being able to manage the numbers. And that's, again, it's an agency making a presentation. But again, I think all the questions about how does this serve clients, you know, the value of the regional mobility manager strat, and
well, do
I think all these are great
we
questions.
have any end users in this room? I mean, they're the person I want to hear from, the end user, you know, what is their experience going to be now?
Well,
Yeah.
but that's hard to say because I don't even know that they'd be able to speculate or we'd be able to speculate on that because we don't know what the service packages would look like with this realignment.
Well, my understanding is that, you know, some of the conversation was pushed on, well, you can keep all the MOUs you still have and still do that and still work outside your area through MOUs. And that might be fine and dandy, but what about to Carol's point, as people are aging and they're now finding out about transportation and the abilities or the programs available to them, how do they now start to weave into a system that could potentially now be moved? Like, oh, I know you were told to come here, but now you don't come here, you go there.
Oh, does that get to the whole suggestion that's in, I think it's in the CTNA and a variety of other places, to make the one central hub, I mean, taking the model from TripLink over in the coast area and keep New Hampshire moving. Document, put staff there, put resources there. So we have one place to go online. We have one call center, or one call center that may not be regional, but can put people in the right direction.
Yeah.
Because quite honestly, if you go to 911 New Hampshire or Service Link or whatever, the information, even though we try to update it, is not shared appropriately. I mean, dear Lord, I can't tell you the number of clients that are referred to SVTC that live in Nashua. You know, we don't serve Nashua residents. You need to call Carrie Miller. Well, you need to call NTS.
Or Donna.
Unite us too, and that's being funded through DHHS. So is this an opportunity, and I know we're kind of getting off topic, I'm sorry, but is this an opportunity? They did all these meetings and they shared all this knowledge and they were like, okay, so now Dartmouth Hitchcock is using Unite Us. There's some other key players that are using Unitas. So is this an opportunity where all of the caregivers now know if you need transportation, you refer them to whoever the state mobility manager is, and then that state mobility manager, whoever is going to monitor the Keep New Hampshire Moving or whatever, or the referrals, then that person says, okay, mobility manager, Donna, here's, this is for your area. And that's, I mean, why are we recreating the world? They've spent all this money and they've got the contract for.
That, to me, your idea of a centralized intake system makes sense to me.
Yes.
And then you get the right answer all the time, hopefully, as long as your staff is trained and the lines are drawn on where. That, to me, is an efficiency for the end user.
Right.
Because then you have one group of people, whoever's answering that call or email is always going to the right place. That, to me, would seem to be an efficiency that doesn't need to have this happen.
Right.
That's to me that's coordinated transportation.
And where I'm coming from, Homeland Security, is I worked for a long-term care case management company in Connecticut for 15 years. They at one point covered the entire state. And one number to call, and we brokered services through DHHS, through what you guys call the Choices Program. We had private pay, we had a bunch of things. But we had one point of calling, and then they would work with you to get you to the right office and get it straightened around. But it worked.
Yep.
It worked, yeah.
That comprehensive model that they're talking about from experience makes a ton of sense. You've supported it. It would probably have a very significant impact that's measurable. But our original conversation when this issue came up was they were looking to cut positions, not strengthen it. It almost looks like it's kind of a budget type realignment, which might ultimately weaken.
But I think it gets to a different plan.
The approach that they're describing.
I think it gets to a different plan. I think it brings up something you mentioned, or you mentioned within one of the conversations here, about the value of the statewide regional mobility manager network.
We should endorse that model.
We should build on what we have. Oh, we are around the table here. Is anyone else who hasn't had a chance to pipe in want to share something? Observation, concern, question? This is a hot topic.
Quick question. So the meeting for the SEC is on the 3rd. It sounds like NRPC will put, or is the memo y'all are working on, will that be on behalf of RCC7?
It's on behalf of the RCC.
Okay. And so is this meeting, people can attend, can they ask questions at the meeting?
That will be up to the chair.
Okay.
And in the past, it has been, depending upon the topics and the agenda, it's been restricted to the SCC members. If there is time, they will take questions from outside. It's all, it's their meeting, they're in charge.
Well, you can comment in the chat.
Assuming NRPC and potentially RCC7 representatives will be attending, will we get an update on how that discussion goes?
Absolutely you will. That's why we're having a meeting in September. And if there's anything hot, quite honestly, you'll get it in your agenda packet or earlier than that. All right, moving on. Good discussion, guys. And good feedback, I think, too, especially for Deb and for Angelique, who are both on the SCC. So
thank you for that time.
So we're gonna pop down here, the Community Transportation Network updates. When we were meeting earlier, there were a lot of things that just were popping up. So we wanted to kind of bring this all together and give everyone kind of an opportunity. A lot of things have been happening in July. Carrie, why don't you lead us off?
Sure. So I had asked, thank you, Matt. I appreciate that. I had asked Salem and Matt earlier if they could bring up a page on our website. So I'm gonna just go over, we have some new technology that Nashua Transit is using. It's pretty exciting because it was a long time in the making. So, but before and it's in regards to real-time bus tracking. Before I get into it, I do want to say that these things are only a guide. They're in addition to the general things you should already be doing if you are regularly riding our city buses, which is be at your bus stop early, have your fare ready, and just be ready to board when you're riding the bus. But this is not in like in place of anything or in place of our schedules or anything like that. It's just in addition. It's a resource. So Matt, could you click on the thing that says new tool, track your bus in real time, read, like, yeah, just click on that. Thanks. Okay. So we have two things. One is a transit app, and the app is called Transit App. Other transit systems use this app. So Nashua Transit is one of many transit systems that are now using this app. You can download it on your mobile device. It's a green square with a little squiggly line through it that kind of looks like a bus route. And it's to track where the bus is, live, real-time bus tracking. And in the transit app, you can so there's two versions. You can get a free version or you can pay for a subscription. With the free version, you can see the bus routes that are closest to your location. If you pay for it, you can see all the routes all at once, like no matter where you are. So there's a benefit to getting a paid version.
What's the cost?
I don't know what the cost is. It might be like $10 or I apologize, I'm not really sure. Sorry, I don't actually know. I do not know what the cost is. So sorry, I shouldn't have said a dollar amount, but you pay something. But the benefit is you would be able to see no matter where you are in Nashua, you could see like any bus route that's around you. And so you download it on your phone, and you can see, like if you just have the free version, you would see the routes that are nearest to you. So if you were over by, like, if you were on 11 Riverside Street where our administrative office is, you would see the Route 6 and the Route 12, and you could see when the bus is approaching the respective bus stops in the area. And it'll show you on the app, the little bus moving, so you'll see where it is and how close it is to where you are. And it, will provide approximate times for arrival. If you were at a stop that's a time point on our schedule. Time points, the buses are supposed to be there at that particular time, like a regular bus stop, the time is approximate. So if you're checking real-time bus information, that's why I say still be at your bus stop early, because it might tell you, 42 minutes past the hour, but doesn't mean it's going to get there exactly that. It might get there at 43 or 41 or something. So that's why we always say be early to your bus stop. So that's pretty cool. It's really great. I've used it a few times doing some travel trainings recently, showing people. So feel free to go to our website here and get some info, or download it on your phone to check it out. It's pretty cool. And the other thing is, this is something we've always had, but Google Maps. You've always been able to use Google Maps, just going to Google Maps, or on our website on the homepage, we have a trip planner, and you can put in your origin and your destination, and you can even put the times that you're looking for to take the bus, and it will take you directly to Google Maps. But a new thing on Google Maps now is that they have real-time information. They'll tell you, again, approximately the time the bus is going to arrive to your bus stop. And it'll say if it's running early, on time, or if it's delayed. So like it might say delayed due to road work or whatever the case may be, but it'll give you that information, which is really great. And then so Google, of course, you can use it on your mobile device or on a desktop computer. And so Google, thank you, Matt. If you go to directions, like do the little arrow, yeah. So see the icon at the top, that's the bus. So you can choose directions if you're driving, walking, using a bicycle, airplane apparently too, and or the bus. So if you choose the bus icon, you put in your origin and your destination, and it will show you the routes that you could take on the city bus to get there. You can put 30 Temple Street if you want, fine.
Yeah, cool.
So.
Come on.
A little bit of a spelling error there. Oh. There you go. Yeah, so looks like, I'm assuming Google is telling you that you should walk to the transit center.
Oh, sorry.
Yeah, no, it's fine.
Oh, okay.
Yeah, so if you go to details, Matt, underneath, see where it says details?
Well, yeah, it says 2A.
Yep, so you're taking the 2A, so it's probably, okay, so it's telling you to walk to the bus stop at Walnut and High, which is an 8-minute walk from here. Get on the 2A, and the 2A will take you to Walmart.
Yep.
That's basically how it works. It's pretty cool. It's very cool, and Google Maps is great. It tells you, like, you can see all the details of your trip. You can see like how far you have to walk, where you have to walk, all the bus stops in between, on the route. It shows you all of that information. It's right there. It's available for you. And, again, the times are approximate. And when you're on the city bus, the bus isn't gonna stop at every single bus stop necessarily, because we only stop at a bus stop if somebody on board wants to get off, or if there's somebody waiting at the bus stop. So that's partly kind of why the times are approximate and based on the schedule, because, you're not necessarily stopping in every single.
And so MTA's on Google Maps too with real-time info?
Yep, and they have their own transit app as well.
Yeah, so if you're trying to do that type of thing, and I'm sure Lowell is also, so.
Yep.
Yeah.
And then the other thing we have is, Matt, if you could go back to the, our webpage.
Your webpage?
Yeah, I think do you still have it up?
Hampton rides?
No, not Hampton. Although I can mention Hampton.
Well, it was on there, that's why I said it.
Okay, yes, it is on there.
Exciting fun.
So, quick digression. So Hampton, like Manchester, we do 2 buses. Well, we do buses every summer to bringing people to Hampton Beach. Usually we do 4 trips, one June, July, August, and September. 2 buses on each day. We pick a Saturday each month, but this year we only did 2. We did June for the Sandcastle Festival, and then September for the Seafood Festival. It is sold out. But we tell people, if you want to try to go and you haven't bought a ticket yet, you can go down day of, because sometimes people buy tickets and they don't show up. So you could go down day of and they would let you on board and take you to the beach. So, yeah.
For the transit app, it looks like you can do $5 a month or an annual pass of $25 a year. If you make less than $30,000 a year, you can get it for free. You just need to reach out for them.
Oh, thank you.
They have a little
That's so great.
FAQ section about it.
Well, thank you so much. I appreciate that information, because
The other nice thing about the transit app too is you'll see like Dartmouth Coach or Concord Coach or any other buses that are in the area.
As long as they're on the app.
They're also on
so
the
you
app.
can
That's
meet your
okay.
connection.
Seems like there's a lot that are on the app.
The other thing is, it's also in that little article, if you wanted to click on that again, is, this one. No, that's right. Yeah, it's fine. Just if you could scroll down a little bit. Can you click on the first one? I don't know. I didn't go to, yep. And if you could scroll down a little more. Okay. So the other thing I wanted to mention is we have 2 softwares we're using now. They're new-ish. We've had them for a little while. Swiftly is the one we use for our fixed route for the regular city bus. So we have a Swiftly predictive map. It's another tool you can use. You would use it on your desktop. It's not on your mobile device. You would have to go in there, and you would need to know some information beforehand for using this. So it's not as like maybe user-friendly as Google Maps or Transit app or something, but you would have to know your route ahead of time and where you're going and where your stop is, but you could put it in there and it will show you the information. It's not like a real-time tracking necessarily. It doesn't show you the little bus moving like it does in the Transit app, but it's another tool that we have that's it's pretty great. It works well, and it's just something you can add to your list of resources for information about our bus system. So yes, just wanted to mention that. And and then the Transit app and Google Maps are updated like every 2 to 30 seconds, so it'll always be refreshing the time and things like that when you use it. So, yeah.
Can I ask, Carrie, so is the capability to track in real time in Google Maps, is that new?
Yes, it's new.
Okay,
It's something
gotcha.
that we have been working, well, not me, but our communications person had been working on for a while with Google to give them information, and then through the new tech, the new apps that we've got, when we had those up and running, we were finally able to get the real-time information to Google. So yeah, I actually like accidentally discovered it one day. I was like, "What?"
Yeah, a lot of other transit agencies have been on Google Maps with real-time information for a while, but it depends upon the software and the technology that you have
Yeah.
to be able to push that information up. So it's that interface.
Yeah, it takes some time, but yeah, it's great. I'm so glad that it's available now, so.
Great, thank you very much.
Sorry, I
Go
have
ahead.
another quick question.
Yeah.
When you do the travel training, do you also go through these?
Absolutely, yes, I do.
The next three items, we're gonna kind of run through them really quickly because I really want to hear from Donna and the new program that we have. The Lowell Regional Transit rides up to Nashua, but not to Nashua, they're at the other end of the Pheasant Lane Mall, still in Massachusetts, since they can't bring the buses into New Hampshire. But how are they going? Matt?
Great.
Yeah.
Oh, sorry.
Oh, go ahead.
Oh, I just, sorry, I just, so far there's been 1,700 rides last month, which is 1,700 like boarding, so it's like not 1,700 people, but you know, a lot of people. And then Camille said they added a UMass stop, and then of course it's, I think it's been running since like July 6th, so, yeah.
Yeah,
Right.
I would just say they like exceeded your expectations.
Yeah, they did not send out any promo packages or media packages because we had really wanted to be able to help push that. But again, following their lead, they didn't, so we can at least word of mouth it.
Yeah.
I know we've been trying to SVTC's been trying to word of mouth it at least for the little picture that we grabbed off of Facebook, but
I think the college students are doing a lot of word of mouth.
I bet they
Yeah,
are.
I know they've met,
Yep.
especially with the UMass Lowell to tell them about that, so they did that outreach.
Nat, we did want to bring everyone kind of up to speed quickly on the 5304 and 5305 planning grant. One of the items in our long-term plan and on our goals was relative to supporting NRPC and coming up with some ideas relative to them applying for a planning grant for transportation in our region. Unfortunately, there's been a few changes from New Hampshire DOT proposed.
Right, so yeah, every 2 years, DOT they release a statewide solicitation for the FTA 5305E funding program. That's a statewide planning and research program. They are considering changing how they do this solicitation, and so the MPOs are eligible for applying this funding, and in the past we've done at least 5 that I'm aware, I remember, the NTS expansion study, NTS strategic plan, our volunteer driver program study, locally coordinated plan, we funded through that, although we can do that through our UPWP, and the transit modeling study that we're working on right now. So, you know, we've definitely used the funding, but DOT is proposing to change that, and they're going to use they propose to use the funding for something else, and it would be some of the funding would go to support an SCC secretary, because that's been an ongoing kind of gap apparently with the SCC. So the idea I think would be to
big questions about that.
So direct some of this funding to paying for that secretary, and that secretary would be from someone from one of the RCCs, maybe on a rotating basis. It would also fund some of that funding would go towards a statewide coordinated plan. And the idea would be we wouldn't have to do the locally coordinated plan on our own. The state would do it, and then the RPCs and the MPOs would contribute to it, would be asked to consult on it. So our locally coordinated plan would become a statewide coordinated plan.
It's something they've talked about for a couple of years.
And I did look it
I'll
up
grant them that.
The NRPC has an additional designation as a transportation management area. And I wanted to make sure that, I mean, because this is a federally required document, and if we want to get 5310 funding in the region, you got to have it. And so I did look at that. As far as I can tell, NRPC doesn't our MPO doesn't have to have our own plan that we've developed, although that's what we've always done, so. I guess, so it would be, the state would probably contract that out. So that,
Is that an opportunity to reduce the funding that you get through your UPWP?
I don't, that's not stated here. That would,
Just saying.
yeah.
Just
They're rather
saying.
that would make our funding go
Well,
further.
And she says it has been mentioned.
Another RPC had the same question. Is that going to reduce funding through UPWP?
Yeah.
Yeah,
Again,
right.
again, the what we get through the LCTP program, the locally coordinated transportation plan program, planning program, a lot of that data we use in other areas, so it's not just siloed.
Right.
You know, it's spread over for the RPC. Okay, sorry, I didn't mean to stop you
Right.
there, but
And they would also propose to use a portion of the funding for statewide transit studies that aren't the same as a locally coordinated, so. So that comes out to about $115,000 of a total of $165,000 each year. So the other 50,000 would be distributed among the 4 rural RPCs for them to do transit specific things. So
again, the 4 rural RPCs. Right?
yes. So that's the proposal, and it's, I think, to be continued. I do think that whereas we've always gone for that funding successfully, other MPOs haven't. They, some have, some haven't. So I think it's sort of this mixed feelings about this proposal amongst the planning commission.
And why are the four of the RPCs being pulled out of all of them to get funding? You say 4 rurals, why? I don't understand that. That's a question. I don't want to belabor the point, but.
Who's gonna do it?
I just have a question about like the process on this, like this was proposed to RPCs?
It was discussed at the regional planning
And then
commission
who's-
directors
who's-
meeting.
Like, is there a vote happening on that? I mean, I guess I'm just wondering, like, do we have any control over this or like, I mean?
Well, I think it was proposed to the RPCs, and the RPCs are kind of agitating on it and thinking it through, and potentially we're gonna get back to the, it's not a done deal.
So it would be up to the RPCs to determine if this proposal.
No, I
No,
think
it's up to New Hampshire DOT.
But I just want to clarify.
Yeah, no, it's up to DOT. RPCs can comment, and that's to be continued at the moment. And
I like that verb cogitating. Let's make sure we get that into the minute.
Yeah.
Do you know if they're building that capacity in-house or they plan on contracting that out?
Contract it out like they do everything.
You're gonna contract that out, right?
Yeah, contract it out.
And people.
The other one is the
Go forward. Yeah.
the project or the bus from Keene to Nashua, and that's DOT put out a request for proposals a year plus-ish ago. Proposals to do like Greyhound type service from Nashua, Keene to Nashua via Peterborough, and I think also to go from Keene to Concord. What is basically,
Oh, so Keene to Concord is included.
I think that's
part of the RFP.
proposal, the request for proposals, but as I understand it, it's just Keene to Nashua.
Keene to Nashua, okay.
That the provider proposed to provide. And I think where that's at now is that provider is reviewing the contract. You know, DOT put together the contract, provided it to, I think it's Greyhound, if that makes sense.
Don't put that in the minutes.
Don't put that in. But it is that type of bus, and and so the proposal is to go from Peterborough or Keene to Peterborough to exit 8. So that's what the contract would be, or that's what the service would be with options maybe to add other stops.
But we bring it up because it's an important piece that may have some great value to residents in this area.
New college students.
Well,
In-state's big.
yeah, in the college students too, but I know that over the years, we've had a number of requests for trying to get to Peterborough. And then a number of people who want to get to Keene, again, depending upon the scheduling and that.
So it's
too.
not a commuter service, and it sounds like they might be 2 trips per day, 1 in each direction
Yeah.
type of thing. And governor and council needs to sign this. So it's kind of like, don't talk too much about it until it's actually signed. We just want to make sure the contract ends up getting approved. And then theoretically, last I heard, service would begin in October.
So
we'll see.
All right, I really am watching the time. I know we're a little bit over the 11:30 hour, but I really wanted to make sure that we hear about the new program that started at NRPC, thanks to the opioid grant. So Donna, if you would like to speak to that, that'd be great.
Sure. Thank you, Janet, and thank you, everybody, for being here and attentive to this time. So we applied to the New Hampshire Charitable Foundation, and we did get the grant, and the grant was for $38,000. It's over 2 years. So this year we're getting 19,750, and then the rest in the other year. And so it's mainly for rides, but there is some administrative funding as well too, and then some mileage, paper, just things we'll need to keep this going. So this is it's just starting, and I'm trying to get the word out. So if you get sick of it, just listen and pass the word on. And people that work actually with caseworkers that work with people, please get this word out, because we definitely want to get this revenue out to people.
Do you have a list of the organizations that you've already contacted?
Yes, I do, Janet. Good, the next slide.
Great.
Let's go, the next, oh, no, wait a minute. Okay, go back. Okay, so those are the outreach events that I've been to, and I've announced this too. And twice I've been to the mayor's opioid meeting in City Hall, and that's where most of the caseworkers that actually deal with this type of client, because it's a specific type of client. So most of those people go to that. So, and then a lot of my regular meetings, and now I've been announcing it and sending it out as much as I can to get the word out there. Because as we all know, and especially Terry, you know how difficult it is to get the word out to a lot of programs unless you have lots of revenue to spend on advertising. It's very difficult to get the word out.
So have you contacted the National Telegraph and all the local papers about this?
Not yet, but that's coming, Janet. I'm gonna do a press release. I'm gonna get that out to different people. I did do one. I have been on the radio. So I've been on the radio about this, right, Sarah? So I've been on Mike's show. Is Mike still on the? No, Mike's not on. Okay, so I was on Mike's show. I've been on Dawn's show talking about it. So it's we all know it's difficult to get the word out about things, but we're doing as best we can. And Emma, where did Emma go?
She had to step away.
Okay, so Emma had the HHW, which is Household Hazardous Waste, and she helped with that too. And I'm gonna go Monday to Pelham to try to talk to some people out there in Pelham. They have a vigil for drug abuse in Pelham. So I am gonna go to each town, because I think people think this is all Nashua, but the opioid crisis has impacted so many families throughout the region that I am gonna do a little tour around the region. So Marina, did you have a question? Oh, okay, you good, okay.
And you have a plan to contact all of the town welfare agents in all the towns and share with materials? I mean, one blast email out too with the information might be helpful. It might save some time too.
Right, well, actually, that's a good idea, because I could do that as like a pre-outreach so that people kind of know what you're talking about. Because lots of times people, they hear, there's so much stuff out that they hear something, but it doesn't really sink in until you get it in repeatedly. That's always been kind of like, you have to do repeated outreach all the time to get people knowing about.
Yeah, and actually, just to fill it in, just to jump in here and let you know, we put this together
that's
for
good.
SVTC.
Good.
And we used it at our outreach, and we'll use it at continuing outreach just to get it out. We had a few people that were actually react and said this is a great idea, so.
Good. Thank you. Thank you for doing that. I didn't see that until I saw it. I was
Yeah.
like beyond Rocky and I saw it.
Again, this
So-
is kind of falling in line with the LCTP goals of trying to improve communication and collaboration. We can all share and support each other's work.
Right, exactly. So, so then we want to get to what activities are eligible. So, not everything is eligible, but the things that are eligible is basically anything that revolves around treatment. So that could be medical. It's also getting to drug court or getting to the court, because a lot of these calls, that's what they're for. People need to get, to their, I don't want to say sponsors, but the people they report to in drug court. So, and actually Mike had asked Jay at one of their meetings about getting transportation to get a laptop. Would you give out the laptop? And that's helps with their treatment. So that's allowable. And then so NTS, thank you, NTS. So bus passes, we've done that. And thank you, Carrie gave me some free bus passes today because we do have a check for her, but we'll do that on Wednesday and we'll get a picture with Camille. And we did want to get, so we just keep on going, we'll show the Manchester too. Okay, so this was one activity. So the whole recovery, it's a different group of people. It's like another tribe, like we're a community transportation tribe. So the recovery is a whole group of different people. So little by little, it's getting known. And this is a recovery walk that they had last minute on Friday, but it was well attended. Public health was there. People from the doorway, some of the people from the SIM meeting that I attended before were there. And there were just a lot of people that are in recovery. And so I passed out at least 50 of the flyers. So that was last Friday, a week ago. So okay, so this is what's coming in so far. So one request was from a caseworker from Harbor Care, just asking for information because I did a presentation at COC and I mentioned this and she called. And then a public health worker called about a client who needed a ride to Manchester. So I called Manchester Transit right away and I got put through to Mike right away. And he said, oh yeah, get the person on the bus. I'll contact the driver and then we'll, just have it happen. And then we'll figure out the funding and the bus pass later. So he did that. I went down to the transit center and I waited there to see if I could find the person. I got a good description of the person who needed the ride, but the person didn't show up, which is a lot of common. Sometimes this happens with this clientele. It's like they're supposed to be on the bus, but they didn't get to the bus. And so they didn't get on the bus. But I do want to thank Mike as well as thank Terry today. So I don't know if you have your camera, you can take a picture. So should we take a picture up there?
Sure.
And then you can see the bus.
We want the passes.
Donna, I just have a question, like, so is it like cross-regional?
Yeah, can you wait just 1 minute, please? Because we just want to do this.
Hold that thought.
And I'll
We
get
have
to
no
the,
idea what you're doing, but whatever.
I'll get to the.
You're doing from a picture.
Thank
No,
you.
I
from
don't
the account.
understand, so that way I know.
No, can you go back and get the Manchester bus? You wanna
Yeah,
get
I
this,
didn't
so
know.
you see- did you get the-
I knew we
did you get it? Yeah, so it was a bunch. Thank you. And here are the passes and here's, you take the check.
It's region one.
And thank you, Terry. Yeah, of course.
That's
Good.
No, we get along.
And what are you presenting, Donna? Sorry.
So these are the passes. So that's a check. So we have funding from Manchester passes because a lot of people need to go to Manchester because
Right.
it's Hillsborough County. And
Thank you
that's
very
where
much.
the, court is, and that's where the jail is.
Donna, how many days in advance do folks have to call you to either arrange a ride with Uber, Lyft, or taxi or whatever, or be able to connect on the bus passes?
So as long as I'm there, I'll try to get it going for them. I don't really have, if I can do it, I'll try to do it right away. So when they need it, it would be nice
But
to have.
if I call for a taxi ride for today, would you, and you were busy, I mean, normally there's kind of at least a little bit of a window of call at least a couple of days in advance kind of thing to give us time to do it.
Well, so ongoing, I'd like to get it done. So if people call me, I try to get it done as soon as I can. I don't really have those, we'll see how much demand we get. But like with this, I tried to get that done right away with the passes for NTS. I actually had some other free passes too that I could have given to the person that needed some bus passes.
So do we have arrangements set up with Uber and Lyft yet?
So I did one Lyft ride, so we can do that. And then
How are we doing that?
So I just did it through, I have a Lyft account and I did it through my Lyft account. And then, and the person got the ride. So then they,
okay, I'm gonna put my NRPC
Okay.
treasurer hat on that
Can I
one.
finish?
Are you working on contract?
Can I finish? Yes. Nicole, who's, people don't know Nicole, she's our finance director. She's working on getting the Uber business account set up. So that would be the Uber one. And then.
Can we get a Lyft business account set up too?
I don't know if they have it, but we could do that too if they do.
The only reason I'm asking too is that this would also benefit the community rides program. If those are in place.
But I do want to say, doing this one recent lift for the SVTC person that needed a ride, it's very expensive. You wouldn't think it, but the local cabs are much less expensive. The lift it's very.
Was that for a ride Nashua to Nashua within Nashua?
No, it was from Milford to Milford, the court in Milford. So so that's what that ride was.
So it was within Milford.
Right.
To go from their home to the court and then back?
Yeah.
Donna, I just had to arrange an Uber Lyft, so I missed what you were saying. The Uber was going to charge me $99 to get the client to, the taxi was going to charge me $99 to get the client to Concord, and it was $38 with Uber.
Yeah, because again, we know that a ride in Milford, without looking at the mileage, is $156 using Granite State Taxi, because we've had one before. So again, 99 is better than 156. Yeah, again, these are some of the outcome and evaluation pieces that we also have to look at too long term. Again, you have to look at, because again, this is an NRPC program.
Right, exactly. Yeah, exactly. So anyway, so thank you to Mike, who kind of made that happen, because it was quick and I didn't have passes yet. So thank you. And then next. So anyway, if you do know of anybody, and there's some flyers there, if you could please get them out as well. Just let people know as much as you can, because it's a lot of stuff is word of mouth, and we will get the press releases out.
Can you send that to us in a PDF format, or can you send it to me, and what I'll do is include it in the follow-up for this meeting? Or I'll just take my own and cut it around. I can do that. That'll make that a
I
PDF.
have it a PDF.
Yeah, it's the same thing. I scanned it in and created this.
Thank you, Salem, for.
So we can take care of that and then get it out there. So that if we have contacts that we know, to again spread the word.
That's good. Spread the word. That's the thing about this, is we gotta spread the word, because we want to get this funding out to people who need it. Because we know it's needed. It's like, I've had some people call and they've been desperate to get this treatment. So, and you can just tell them their voice, like they're desperate. They need this.
I just want to clarify, like, specifically a little bit about like eligibility. So do they have to like originate in the Nashua region? Do they, what's the questions like, or is it anybody who says that they're having an issue with substance like opioid? Like, I guess I'm just wondering about eligibility. That way I don't like send people to you who might not be eligible for service.
Right, so it's the 13 towns here.
Yes.
So it's the greater Nashua region. So that's what the application was for. But I think if people do have issues.
It's residency within those 13 towns, and it has to be a ride related to their recovery, opioid recovery, correct?
Yeah, basically.
And that's why you need the Manchester bus passes to get up to Manchester.
Right, because people need back and forth.
All right, gotcha.
We've had folks from Lineborough and Wilton that have used the rehab facilities over there for addiction.
But as far as like them just, saying they have, like, I don't, substance use or whatever case, we'll just send them your way, or there's no specific like eligibility surrounding that, or?
Well, it is the Greater Nashua, that's who, we applied for Greater Nashua region, so.
No, yeah, I mean, I guess like, so like, you know, for our service, like we ask people, do you have like a disability? Versus like if somebody tells me they have they have substance use issue and we don't ask, you know, what that's about. If somebody's has an alcohol, you know, use disorder, they're not eligible for this service.
Yeah, alcohol, it's opioid, it's opioid.
When in doubt, I would say send it to the regional mobility managers.
Yeah.
Because at that point, again, they can tier out of, okay, would this qualify for this program?
Yeah.
No, they live here, so they could qualify for NTS, they could qualify for this program, and we have 3 on the plate right now, pretty much. So again, that's the role of the regional mobility manager to figure that out, and then maybe if they're eligible for this program, it would funnel through that funding stream.
Send a lot.
Thank you very much for coming. I know we're ready to go, so we're gonna make this real quick.
Awesome
What
job,
if
Donna.
someone who lives outside of our region but wants to get transport to our region for some services?
Call the
for
regional mobility manager in that region.
In that region, they wouldn't be out of this.
Well, if they're coming here, say, and what's happened throughout the state is that there are a lot of recovery houses in Nashua. There's over 80 recovery houses here, and the state is sending people here. So it's probably that's the case. And then if they're gonna be coming here, then they'd be eligible because they'd be in a recovery house here.
Here, okay.
Pick up locations in the region.
All right, thank you very much.
Awesome job, Donna.
Yeah, great
I
job.
love the branding, dial Donna,
Yeah.
brilliant.
All right.
I'm not standing up.
So we're gonna roll
I've been
forward.
wanting to do the dial
Very
Donna since
catchy.
I started here a year ago, so I'm glad I finally have a reason
I
to.
will remember that, most people will.
So I know we're like right on the cusp here, so I'm gonna keep the rest of this really short. The last item really on the agenda is the LCTP Goals Subcommittee update. And basically in your packet attachment 4, major piece is that Carrie, as part of our first goal regarding coordination and collaboration, put together a list of all the other RCCs and their meeting times with links to the information on the Keep New Hampshire Moving website. What we're trying to do is to get as many people that want to, that are interested in attending those meetings, either via Zoom or in person. Again, to keep the conversation going. I know Carrie's done a few, Matt's planning to do a few, I'm planning to do a few. But I think the most important one there, though, is gonna be the SCC meeting on September 3rd. And we'll get that information out, hopefully in the next 24 hours.
1:30 to 3:30.
Yeah. So, and we will have more, the subcommittee will have more information for you at the next meeting, but we're running a little late.
No, it's
Does
fine.
anyone have anything pressing they want to add? Anything big coming up?
Yeah, so we've got some exciting things. 3 exciting things. We've got fundraisers, pickleball tournament, pub crawl in September. I think the pub crawl is September 12th, pickleball is September 19th. And then on September 25th, we have it's a meeting at Southern New Hampshire Health. And it's a breakfast meeting, and it's educational for social workers and other people who work with clients about online scams and online safety for and we're trying to target people that work with very low income people. So those are the people that we're really not able to reach, that we know need assistance with learning tech skills and just generally staying safe from scams. So we offer classes at the Y, and the people that attend those classes are people that they have other means to get education. We're trying to reach the people that don't have other means to get education and stay online safe. So we're trying to target the social workers and other people like that. So it's a breakfast meeting. We're having an activity led by UNH Cooperative Extension. And then we are also having somebody from the Nashua Police Department that's going to be talking about current online scams, also phone scams and things like that. So it's about online safety. Everybody's welcome. And we'd love to see you there. The information's on the United Way website, or you can email me, and we have flyers over there. well.
Yeah, and I'll actually take copies of each of the flyers and I'll just scan them in and then we'll send them out in the follow-up.
Thanks, Jen.
Cool.
Can I ask a quick question? You had mentioned you're collecting shoes, donations of shoes?
We are collecting shoes until the end of the day on Monday.
Monday,
So
thank you.
yes, so if you have shoes, we would love them. We're also doing another shoe drive in November and December. So if you don't make it now, we will accept them in November and December too. And then we're also doing a coat drive. And that's starting September 1st at United Way office and other locations. And I don't have all of the information about the other locations right now, but we're gonna be collecting a lot of coats too.
Awesome.
For both the coats and the shoes, are you looking for specific ages and sizes or just everything and anything?
yeah,
Like
everything.
things my kid has grown out of that are still good, I should bring those?
Yes, yeah, and this year we're also collecting snow pants.
Ooh,
We were
okay.
not previously, this year we are.
Smart.
Great. Great. All right.
And
Well, it's the bewitching hour.
Motion to adjourn.
So moved.
11:58.
Second by Carrie, all in agreement? Yes. Thank you all very, very much. We will see you in September.